All right. It's 1 minute past the hour, and I think we can start. So welcome to this webinar, and thank you for joining. Today's on the Path Live Forum, entitled Getting to 70%, the commitment to vaccinate the planet in 1 year. So that's a very serious commitment that we'll be discussing today. My name is Dr. Emmanuel Mugisha. I'm the director for the typhoid vaccine project, as well as the senior technical advisor on immunizations based in Uganda. And I'm very excited to be moderating this discussion. So before I introduce the panelists, I would like to share with you a few logistical details that you need to follow during this discussion. First, we want to hear from all of you. In addition to sharing your thoughts, questions, and experience over the next hour, I would also want to invite you to converse and share by online using the hashtag #PathLiveForum. It's one word, #PathLiveForum. And then also tagging us on Path Tweets, again, one word, Path Tweets, so that we can listen to each other. Also, please know that this session is being recorded and will be distributed, especially for those who are unable to join us on a live discussion today. And finally, I want to thank all of you for joining us from all over the world, the government representatives, corporate partners, peers, and others. We definitely appreciate your interest and participation today as we work together to achieve the vaccine equity and end the pandemic. As we continue the conversation over the next 1 hour, please keep sharing your questions, comments in the chat. We will be monitoring these comments and questions through all the channels so that we can save time, filter them, and then we'll ask them to the panelists towards the end of the discussion. So I hope that will help guide us in the discussion in this one hour. Now, turning to our speakers, we are so honored to be joined by such well-rounded group of women, as you can see, who will provide different perspectives on what needs to be done to reach the vaccine targets that I've talked about, the 70%. First, we have Dr. Buzai Magazira, who is the Senior Technical Advisor for Research Advisory and Advocacy, working with the Village Reach, originally from Zimbabwe, I understand, but now currently based in South Africa. We are also happy to have Dr. Meseret Shibeshi, who is the Immunization Officer for WHO Regional Office in Africa's Inter-Country Support Team, currently based in Zimbabwe. And last but not least, we have Dr. Professor Petro Tabranche, who is the Managing Director for the African Biologics and Vaccines and Professor in the Health Sciences Department at the South Africa's Northwest University. So a huge thank you to all to you for joining us today, and a very huge welcome to our panelists today. So before we engage our speakers, let me share some little bit of background about today's conversation of the 70% and where it comes from. So at the end of September, President Biden of USA, just to remind every one of us, convened the virtual global COVID-19 summit focused on ending the pandemic and building better health security to prevent and prepare for future health threats. And at that summit, there were many world leaders and representatives from international organizations, private, public sector, civil society, academia, and other stakeholders who are committed to the WHO's challenge to vaccinate 70% of the population of every country within 1 year. That's 12 months, which is a very big challenge. The commitments made at that summit are promising, but unfortunately, we must begin urgently a comprehensive process where commitments can be translated into action, and that's us to do it. So as we stand today, and as we know, unfortunately, less than 3% of the people in low-income countries are vaccinated. So achieving this ambitious goal of vaccinating 70% of every country will require leaders to understand the challenges that exist in the low and middle income countries, and which must be emphasized in this discussion. So in today's discussion, we'll discuss, or we'll talk about how we can get this moment where we stand today and look at the critical next steps that are needed to achieve the vaccine equity and end the pandemic as we move forward. And with that, I will turn it over now to our panelists to talk to us today. Now, let me start with Dr. Shibeshi. So Dr. Shibeshi, we are now almost 2 years into the pandemic. And while an impressive 5.7 billion vaccine doses have been administered, unfortunately, 70% of those vaccinations have actually happened only in 10 countries, and less than 3% of African countries have actually been vaccinated. These numbers definitely point a staggering picture of global inequity, and we think we need to do better. In your view, what considerations of the unique needs of countries across Africa must be prioritized to make sure that the 70 vaccination goal is met? Over to you, Dr. Shibeshi. Dr. Shibeshi, if you can kindly turn on your microphone.
Thank you very much.
Yes, please.
Yeah, thank you so much for the opportunity, and Emmanuel for the introduction. Indeed, the inequity of vaccine distribution worldwide is alarming. With most African countries, like you have said, still pursuing a 10% coverage target, never mind the 70% that we are aiming. For the African countries, we set a target from WHO to reach at least 10% by end September, and also 40% by end December 2021. However, so far, only 15 African countries made the target of fully vaccinating 10% of their population by end of September. So this leads us into a long way to go to reach the year-end target of fully vaccinating the 40%. This also means further that 70% of African countries have missed these important milestones to protect their most vulnerable. And even more serious, that half of the 52 currently vaccinating countries in Africa have inoculated less than 2% of their population, as you have already emphasized in the introduction. So coming to your question, to achieve the 70% target by mid-2022, Africa needs further supplies. We're stating that estimated 1.77 billion vaccine doses are required. This is critical. And we understand the challenges could vary between countries and regions, but the shared common biggest hurdle for Africa has been the unavailability of anticipated supplies. How do you plan when you cannot anticipate how much is coming? It's coming in bits and pieces. And you know that Africa has the biggest experience in vaccination campaigns, vaccinating millions within a week or two. However, when you don't know how much you are going to get, it's becoming really a challenge. Let's also note that the COVAX was effectively locked out of the vaccine countries from the start by the wealthier nations, where they locked all the supplies for their own population. So, and we remember also the India shipments. We know when India had that huge surge of cases, it had to discontinue the shipments. So all these have been really playing part. Interestingly, the most striking commonality that we see in the few countries who made, like I said, the 15 countries who made it to the 10%, is that they have access to a steady vaccine supply, be it bilateral deal or purchasing. So that has come, and all of them were able to administer more than around 25 doses per 100 people, at least one dose. And they have resources to procure the vaccines to strike their bilateral deals over and above the COVAX. So we've seen significant goodwill from our partners from wealthier countries in response to the WHO appeal to share their doses with their poorer neighbors, but delivery commitments have yet to be accelerated if we are to achieve any of the upcoming targets. So let me mention some of the key challenges. The delivery delays, I want to underscore, is contributing to distribution problems across all African countries, making it even extremely difficult for countries to efficiently plan their inoculation campaigns. The uncertainty that I have already mentioned, it's not only vaccine now, even the ancillary supplies, for example, the diluents and so on, and the syringes sometimes. Then the short expiry dates. You have to really, it messes up your plan. Insufficient funding for preparatory and operational activities has certainly contributed at the beginning for the underprepared of arrival of vaccines. However, when we zoom into the countries, what are the critical challenges I want to mention are the storage capacity in some of the countries, the delivery strategies to handle multiple vaccines, although they come in limited quantities, the technology to handle even the documentation for fully vaccinated or even dose 1, dose 2, to track this in the system. It has been really contributing to the challenge. And then also enough number of vaccinators in a mix of fixed and outreach to ensure we go closer to the communities. And you also all realize that the community mobilization to address hesitancy has not been really superb in our countries. So all these have translated in the low uptake. So I have, I think, underscored the supply anticipation of the unknown amount of supply also is playing a major role. So this is what I would like to say, Emmanuel. Thank you.
Yeah, thank you so much, Dr. Sibeshi, for that. And so, yeah, indeed, you've talked about the goodwill of countries who have responded to WHO's call. And we are seeing that actually many of the African countries, we are receiving many of these vaccines from various countries, which is very good. Now, let me turn to Dr. Bzai. I mean, we are now, kind of, because of the goodwill, we are receiving these vaccines from the different countries. But then there's the other challenge. The real challenge now comes where we are now have to make sure these shots or the vaccines get into the arms. So can you, Dr. Bzai, can you describe some of the challenges that face countries and health systems once they receive the vaccines? What actions must be taken now to ensure an equitable and timely vaccination distribution process? Over to Dr. Bzai.
Thank you, Emmanuel, and thank you as well to everybody who's joined. You've raised a very important question in terms of once the vaccine is in the country, then what next? A number of the aspects have also been raised already by Dr. Sibeshi. I'll allude to some of them, but also speak to other ones. So the first one being the logistics capacity. We're seeing more and more that countries have limited capacity to store vaccines. This is not unique to the COVID vaccine situation. The issue of storage is something that has been an issue even prior to the COVID situation. But now we see with the increased demand for storage, the problem has been exacerbated. When you look at storage issues, you start to see the equity issues as well, because you'll likely find more storage in the urban areas than you would find in rural or hard to reach areas. So then in that case, it makes it very difficult for at sub-national level, especially for them to store vaccines. And so even if they are to run campaigns, they can only store a limited amount of vaccines at a time. And then when we also look at logistics, so the transportation of vaccines from the time that they arrive in the country, if we just imagine that vaccine journey from the time they arrive, potentially taken to the central medical store, depending on the structure of the health facility in the country, and then to the time that you actually need them to get to either the health facility or the district level, again, depending on the structure, we're finding that, again, issues with transportation, challenges with transportation remain. When vaccine distribution started, many countries they didn't have reserve funds, or they were unable to unlock funds on time to be able to finance or to fund their distribution plans, even though they had them. We've seen better success where private sector, for example, has been involved in the distribution of vaccines. So some of these are issues that were there prior to the COVID era, but we're just seeing them more pronounced now that there is a larger demand. And so now with a shortage in transportation or limitations in transportation, and what Dr. Shibeshi said earlier, about countries being unable to plan for the supplies that they are going to receive, and perhaps receiving small batches of vaccines at a time, it makes it very difficult for them to be able to plan for their transportation, and in fact very expensive in the end if they have to plan multiple times to get the vaccines to the places that they need to get to. Now let's move away a little bit from the logistics piece and talk about the vaccination sites. When it comes to the vaccination site, which is where the shot actually gets into the arm, we find that initially, in some contexts, there was actually higher than expected hesitancy from health workers. And so there were a lot of assumptions that had been made initially, perhaps about how health workers would take the vaccine. But we then found that there was higher than expected hesitation rates. Health workers are very important for the success of any vaccination program and any health program for that matter. So having them on board whenever a program like this is going to be implemented is very important. And so it's important that countries also increase, whether it's awareness and education, so that they can really get the buy-in of health workers. I know that it's been improving over time as information is shared and so on. And then the low capacity of health facilities to also vaccinate, which has already been a problem with other health services, so long queues and so on, that potentially discourage people from coming. And then finally, the population themselves. When we're talking 70%, we're actually talking about people, and we're talking about diverse populations. And so part of the challenge, in my perspective, has been similar challenges with access, similar to what we found with other health services as well, which is whether people are able to get to where the health service is actually being offered. And so these are some of the challenges in a nutshell. There are many more, but some of the ones that I thought I could highlight today.
Okay, thank you so much, Dr. Vzai, for that. And yeah, you talked about intermittent supplies. Today you have, tomorrow you don't have. So the issue is, how can we get over that? And let's now talk about the manufacturing. And let me turn to Professor Tabranche to give us insights about that. So Professor Tabranche, the importance of technology transfer and efforts needed to expand global vaccine manufacturing were front and center in the global COVID summit. It was recently announced that WHO is supporting a South African consortium, including your company, African Biologics and Science and Vaccines, to establish the first COVID mRNA vaccine technology transfer hub to expand global and regional manufacturing. So, Professor, in your view, how will this help address some of the vaccine equity issues that we've seen around the COVID-19 vaccines?
Emmanuel, thank you very much. And good morning, good afternoon, and good evening to our participants all over the globe. Maybe a comment just to link with Meseret and with Zai. It is essential to have an effective and a enabling ecosystem to meet the goals that we've set for global 70% vaccination levels. However, never in the history of the world has anything demonstrated the importance of manufacturing in various regions to ensure that the supply of vaccines are adequate. And this manufacturing capacity cannot happen only in one single area or in one single country for low and middle income countries where we have seen the vaccine insecurities. So under the COVAX initiative, in multiple partnerships, one component of creating a sustainable vaccine ecosystem is manufacturing. The decision to create a hub for mRNA vaccine was a very strategic decision driven by how COVID demonstrated that we have inadequate capacity in low and middle income countries to supply our vaccines. Just simple statistics, 25% of vaccines, total vaccines are used by Africa. We only produce 2% of it. So this hub is one of a number of models that will facilitate long-term sustainable manufacturing capacity for low and middle income countries. It so happened that the first hub here based at Afrigen is an mRNA platform. There will be future and other hubs created in low and middle income countries that may have other platforms because the focus is to address long-term sustainability. In the short term, this hub has a target to start the process to develop a local mRNA vaccine candidate that is non-inferior to the vaccines that has market authorization currently in the mRNA space. The hub to build capacity processes and then to transfer that capacity in a first step to biovac. So our partner, which is a public-private partnership created here, BioVac, has the capacity to produce 50 to 100 million vials of vaccines for Africa. And that is the first step. The partnership here is a demonstration project with GMP manufacturing for clinical trials, transfer to commercial manufacturing, and then into distribution. The other very important part of the hub is the long-term strategy and the alignment, in the case of Africa, with the Africa vaccine manufacturing strategy. We know that in Africa, there are about 22 key diseases that requires vaccination. We know that we don't have the capacity to supply those diseases. In the case of mRNA, it is a platform that would be suitable to develop new vaccines, improve existing vaccines, look at combinations of vaccines that would address the needs for Africa, and the goal to vaccinate, to produce 60% of our vaccines by 2040. So this hub is a technology platform which leans itself to a long-term pipeline of development of vaccines, more than just COVID. But the hub also, very important, is a capacity development hub. We will not establish sustainable manufacturing in low and middle income countries unless we develop capacity. So the hub has a mandate also to train and to transfer knowledge and technology to other nodes or spokes that will be created in the next few months through the WHO and the COVAX initiative.
Thank you so much, Professor Tabrache. Very exciting to hear of manufacturing capacity in the African region. I think that would help us in terms of ensuring, steady supplies of vaccines. Now, let me get back to you, Dr. Shibeshi. So, in your view, what steps is WHO taking to ensure that leaders across the African region have a seat at the table as key decisions are being made? Over to you.
Thank you, Emmanuel. This is very pertinent. And as all of us will understand, Africa will never have a meaningful seat at the table until we have a sustainable vaccine development and manufacturing ecosystem that secures the continent timely access to vaccines. This is the only fail-safe way we can protect public health security into the future and prevent a situation where we just lived through, we find ourselves at the mercy of wealthier countries, you see. We've seen very clearly from this pandemic how Africa quickly found itself locked out of vaccine supply chain. With even COVAX, which came as a platform, failing to compete effectively with the wealthier countries. You remember that bought up all the doses, much more than they needed. On a positive note though, COVID-19 has significantly accelerated political will across Africa Leaders have been really, around 4 or 5 leaders have been seriously pushing. It attracted firm commitments from the G20 as well and others, as well as a World Health Assembly resolution on local production. I'm just following what Professor has been saying. For the World Health Organization, our top priority now is addressing the inequitable manufacturing and distribution of vaccines that is driving the current pandemic. We should also remember that we have to prepare for further pandemics and many, many types of diseases that are emerging. So the continent has struck several manufacturing deals with companies to fill and finish millions of doses. This is, as example, Egypt, Morocco, South Africa, among others, as a good start. But we need a long-term solution, having our own manufacturing capacity. We have the population, we have the market. However, that will take us long. Then real global solidarity also requires wealthier countries to enable essential technology transfer to be able to produce vaccines locally from scratch. This is both for COVID as well as for routine immunization vaccines. Continuing, it's important to underscore that it's not a question of giving up their patents, but patent protection can be waived for a limited time frame to allay the US, EU concerns around patent protection. However, at the same time, we can allow countries also to be able to at least produce or finish and fill also to be promoted in the meantime. So WHO's proposal is that high-income countries offer incentives to companies as part of their stimulus package. That is like for intellectual property waivers. That could help us or private companies address potential financial loss. But companies also have a social responsibility to share intellectual property. Are we really talking of equity in health? Are we really talking of the sustainable development goals? Getting production capacity into Africa. So vaccines can be produced on the continent for the use within the continent will give African countries more control over supply chains. Yes, we cannot achieve it within 2 years, within 3 years, but I think the dream has to be realized. We have the population base, we have the market, we have experts, but the technology has to be promoted, of course, in collaboration with the wealthier countries and the developed countries. Thank you, Emmanuel. Let me leave it there. I'm sure there will be heated questions with regards to this. Thank you.
Yes, exactly. Yeah, thanks so much, Dr. Subeshi. Yeah, indeed. I mean, yeah, it means we need to be seen to be doing something in order to be allowed to say something. So for us to be on the table, yeah, we have to have some capacity, which we are trying to create. Now, back to you, Dr. Buzai. So as we think about the components that go into the timely vaccine rollout, issues related to training of the health workers, ensuring proper systems are in place to track vaccines, etc. How can we make sure that we are using this opportunity to strengthen the health systems, both to ensure we are better prepared for not only the next pandemics, but also to make sure that we are working to better or improve our routine immunization systems? What areas should we be prioritizing, especially in this 1 year that we are talking about the 70%?
Thanks very much, Emmanuel. I think one of the questions, to answer your question first, is, why are we where we are now? In terms of why are we having to create separate guidance with every critical event? So now we have COVID, previously it was Ebola, and in previous years, it's been other issues as well that we've had to deal with. So it seems that over and over, we have to create new guidance with every critical incident that happens. I think the first thing that we should be thinking about as a community is to reflect on what is it that, where are our systems falling apart? What are some of the things that we can learn from this experience, and also reflecting on previous experiences, and then ensure that we don't have to have specific guidance for something else that might happen in future. Another thing that I can think about is how do we limit vertical programming? So now with COVID, there are a lot of funding that's directly connected to COVID right now. And it works to a certain point because it helps to achieve the immediate goals that may be there. But in some ways, it can also weaken the system, particularly if resources are moved to just a particular aspect of the health system. And so I think emphasizing both from the government side, but also from funders' side, that we need to have more integrated systems. And so even as funding is injected into COVID responses, ensuring that these responses can be integrated into existing systems. Another aspect is can we reflect on how we can better pre-position ourselves for a next pandemic? So one of the aspects that I may have mentioned initially when I spoke were around how difficult it was for countries to, firstly, they didn't have reserve funding, or if they had to get funding from somewhere else, it was very difficult to access it, as it usually is. So how can we pre-position ourselves now during this time to ensure that we are changing the policies that we have seen to be causing barriers at this time, to ensure that we can in future actually have conditions that are ideal or optimum for what we want to achieve. And then also, I guess, finally, also thinking about workforce. I actually saw a question in the chat as well around workforce and what we can do in future. You know, health workforce remains and has always been an issue. I think at this time, we need to think about how we can continue to invest, firstly, in the health workforce that is already available. Firstly, ensuring that they are motivated, they have the right conditions to be able to do the work that they need to do, but also looking at what are the alternative ways of actually increasing the help that we may need on that aspect. This could include the roles that, say, community health workers or others can play, but it could also include the technology, what technology can do where it is possible to utilize it. So finally thinking about the communities themselves, we're sitting here talking about, again, 70%, and we're talking about people. The communities that we seek to serve actually have very brilliant ideas about how a health system could function. So we do need to invest a lot more in public engagement and actually having solutions that are generated from the bottom up. Over.
Yeah, thank you so much, Dr. Bzai, for that. And yeah, in many of your statements, the statement that you gave, you know, why are we where we are? So why are we at 3%, whereas other countries are talking of, 50% and above? And how can we get to the 70%? So let me get back to Professor Tabranche on manufacturing. So Professor Tabranche, switching back to the R&D angle, what is the longer term goal for regional health security in the African region, and what role will R&D play in that regard? Professor?
Manuel, thank you. Maybe let me make a comment. None of us know when the COVID-19 pandemic will reach steady state. The emergence of variants over the last few months and the immune escape and other issues associated with these variants leaves enormous pressure and requirements for R&D programs to look at our responses to what might happen in the next year or 2 or 3 or 4. I also want to make a comment around the comments around IP. We in low and middle income countries do not have to be the net receivers of IP. We also contribute to IP development. So I want to talk a little bit about the hub's objective number 3. The hub was structured with the short-term specific goals to produce a first COVID-19 vaccine, the process development, transfer that for commercial use. But there's a component of the hub which is what we call objective 3. And that is the R&D component. it spans from surveillance, genomic surveillance, identification of variants, testing of those variants in preclinical trials against existing vaccines, development of an approved vaccine, a booster vaccine in non-GMP conditions, and right through a research and development program that comprises universities in South Africa and in African countries to build an R&D value chain from a first sequence or a first identification of a variant in COVID-19 right through to an improved vaccine or a booster. What is also very important, again, in an ecosystem perspective, there are components of the vaccine process, manufacturing process, which are lipids, which are other reagents, where there's capabilities in the low and middle income countries to develop novel lipids, more improved lipids, do formulations for improved final formulations so that we have vaccines that's suitable for the logistical and cold chain challenges that we experience in low and middle income countries. So research programs combining chemistry, molecular biology, genetics, vaccinology, multiple disciplines, looking at creating technologies and products which will lead to long-term sustainability for Africa. So R&D in the African context is a key component of the vaccine manufacturing strategy. And R&D can be a small R and a big D, big development. And the focus of the R&D initiatives, broader than just a hub in Africa, is to look at how do we improve existing vaccines, how do you develop new vaccines, how do you develop combinations of vaccines, and how do we do process improvements on vaccines so that we optimize and we build a techno-economically sustainable manufacturing capacity. So R&D not only for COVID-19, but beyond COVID-19 for what we call the legacy diseases in Africa, critical new vaccines required for diseases that currently does not have vaccines. There was a comment made earlier around rapid response and what would be the next outbreak. Unless we establish R&D capacity and capability closely linked with manufacturing entities, we will fail to address the long-term needs that we've identified and the long-term vaccine and health security that low and middle income countries are now moving towards at a very committed and motivated speed. Thank you.
Yeah, thanks so much, Professor. It is very exciting to know about the manufacturing capacity. And indeed, there are many questions coming from the audience around the manufacturing as well as the other areas that we talked about. And let's first take a look at some of those questions and try to see what we can respond to. This one is not addressed to anyone, but you will see who can answer that. WHO states reaching 70% countries will need equivalent of more than 2 million full-time employed personnel working exclusively on vaccination services. What can the US and other donors do to support vaccine delivery capacity? Perhaps Dr. Bzai, you could take a shot on that.
Sure, thanks, Emmanuel. That's a good point. I think I alluded to some of this in my previous comment. What can US and others do to increase capacity? In Africa, we only have so many health workers, and I think this is why we're starting to talk about alternatives, whether that includes supporting alternative cadres who have been shown to be effective in the response. I know that there are organizations who are trying out community health workers as vaccinators, just as an example. And I think if seen to be effective, these are some of the programs that could be supported. I did speak about ensuring that the health workforce that we have as well needs to be motivated. We can never underestimate what a motivated person can do. I think despite us having other challenges with the actual numbers in terms of the workforce, we know that, you know, we've also had a workforce that is burnt out, is demotivated for different reasons. And so I think that there is a lot that could be invested in ensuring that the health workforce that we already have is empowered and capacitated. By capacitated, I'm even talking about including even making sure that they have the resources that they need to carry out the work that they need to carry out as effectively as they can. And then, in addition, I think even as we think about, you know, alternative delivery strategies, say the community ones and so on, they may require a different kind of cadre. So linked to my original point around supporting alternative cadres in alternative cadres. I know that some countries have also been calling health workers who are now in retirement to assist with the COVID response. So these are some of the initiatives that could also be considered, because that workforce requires salaries and, you know, other incentives for them to be able to come. So for a particular period, these could be some of the strategies that could be supported over.
Yeah, thanks so much for that. Yeah, indeed, we've seen, you know, the non-conventional approaches to immunization, you know, during this period to basically deliver COVID vaccine. So I think most of the African governments have been very creative in trying to reach out to people who need the vaccine. There are many more questions, so please keep sending questions. We will try to answer those that we can. So let me ask this question to Dr. Tabranche. How long will it take to transfer the technology? Do you expect a short-term impact on supply availability, or is this mainly something that will improve supply for the future?
So for transfer of technology, if we have a suitable partner, that is something that can happen in a fairly short period of time. Without a suitable technology partner, we'll have to do some of our own development work, and that will delay the program. We still have a target in the hub to, within 12 months, produce this first clinical trial material, and depending on whether this is a turnkey technology transfer or own developed, the clinical development program may be longer. We have engaged with regulatory authorities to ensure that is fast-tracked. But you are right, this is not a one-year solution. This is a 36-month solution for us to produce a first COVID-19 vaccine locally. In the meantime, it is important to see that this platform was created with a longer-term objective, and that is to create sustainable, long-term manufacturing capacity in low and middle-income countries based on this particular platform, which is quite attractive, quite efficient, and quite cost-effective for vaccine development.
Yeah, thanks so much, Professor. That's very helpful. So back to you, Dr. Buzai. I know you've mentioned, we've talked about vaccine delivery, and you've talked about kind of the country-based resources. But here is the question somebody's asking. So do the countries have the resources they need to support vaccine delivery? But I think you addressed some aspects of that. But the additional question is, are there actions the international community can take to make it easier for countries to be successful in their vaccine delivery efforts over the coming year?
Thank you very much, Emmanuel. That's a good question. I think that different countries or different settings have different ideas about how they could improve vaccine delivery. But this is one area where they can really be more investment, and by investment, I'm not just talking about financial investment, but even technical and otherwise, in improving private partnership with the private sector. So like I mentioned previously, we have seen that where private sector has been involved in vaccine delivery, and sort of integrated into the vaccine supply chain, the public sector one in the countries, then vaccine delivery has been more efficient or much easier. So this is one of the things that partners could support countries in order for them to be able to harness that that strength that the private sector brings. And then COVID has also brought a lot of opportunity for innovation. And so, you know, some of the challenges with delivery have to do with just the proximity from where supplies are concerned, but some of it has to do with actually an inability to access particular areas. And so, you know, the piloting of drones, for example, is something that could be useful in terms of reaching places that are hard to reach. These are just some of the examples of things that could be supported, but certainly in having detailed conversations with the countries, they do have an idea of what it is that could work in particular settings. Also, again, attached to what the delivery strategies will be, that could then determine what the right strategy would be for vaccine delivery.
Yeah, thanks so much, Dr. Buzai. Yeah, now talking about opportunities created by COVID. You know, this is a very difficult word to say. I mean, COVID has definitely disrupted everything, and all that we know is about negative aspects of COVID. But let me ask Dr. Meseret. So do you have, and this is a question also that came from the audience. So do you have concerns about broader routine immunization being impacted negatively by the focus on COVID-19 vaccine rollout? Or is it an opportunity to strengthen immunization overall in the region? Dr. Meseret.
Thank you. You know, the saying blessing in disguise, yes. I think countries should be opportunistic and get hold. For example, it has stimulated our leaders to talk of vaccine manufacturing plants. 4 or 5 of our presidents are pushing really persistently. This is an opportunity. Similarly, definitely we have seen a drop in immunization services, routine immunization services in specific countries where the same immunization team is also doing the COVID-19 focus, all right? But where they have used, like in South Africa, private sector engagement, where the private clinics are also vaccinating and so, you see it is easier. But when you look into the remote populations, be it South Sudan or Ethiopia or, you know, far end, there is a challenge in this whole health system, okay? From the human resources, access to vaccines, you know, they were giving it on outreach basis. Some of the vaccines you get, you need the cold chain, specific cold chain to take it there. Or maybe some of them were very strategic. They used the J&J to the remote populations because it's just one dose. You know, countries are not sitting, they are taking opportunities. I believe COVID has brought opportunities. The innovative technologies that we use for the real-time reporting and so on, that is flowing to the countries. I think that is an investment in itself. But we are also motivating and reminding countries that the routine immunization services should not suffer. I think my colleague Buzai was mentioning, the retired nurses were recalled. Student nurses, graduating nurses, medical students graduating, they were taught practically capacitated so that they could be joining the vaccine force in a campaign mode. The only problem I also bring is unanticipated supply. When you'll get it, you don't know. So for how long will you bring these people? And it also needs additional resources. When will you mobilize them? For how long do you need them? It's not clear. So it's the bits and pieces that is also complicating, but I believe there is opportunity that we can learn a lot from this pandemic, from COVID, like we have learned from Ebola, all right? Even Ebola, it was using similar technologies for the vaccines and the cold chain as well. So I go for more opportunities, but we should not forget the routine immunization and the antigens that are due to be given to the children while we focus on COVID-19 vaccine as well. Thank you.
Yeah, thanks so much, Dr. Shibeshi. I think that's very helpful. Here is a question from the audience. I think this will be to Professor Tabranche. So it says this transfer of technology will be feasible in future if WHO and all the partners agree to standardize the standard model adapted to the information systems integrated into existing primary health care. How do you like this? So I think is, how will WHO help in standardizing systems? Dr. Tablanche?
So I think, yes, for future efficiency, to have a model that works and it's well understood and standardized will be beneficial. Technology platforms may be very different and its applications, but a model where a platform is created, technology is transferred, issues around intellectual properties addressed, freedom to operate, and transfer that knowledge to nodes that can produce and supply vaccines needs to be standardized. A particularly important component of standardization is regulatory. I think that is one of the key challenges to ensure that where these manufacturing entities are created, that the regulatory authorities that has to review and approve those facilities are operating at a maturity level 3. So I think standardization around regulatory is critical. Replicating the model is important because we want efficiency and speed with the next time that we have to do this.
Yeah, thank you so much, Professor. And maybe the last question, I think, to Dr. Bzai or Dr. Shibeshi, any one of you. Someone is asking, actually, many people are asking, so do we have an example of where the private sector has been used in the delivery of vaccines in Africa? Very quick responses.
Emmanuel, thank you. Maybe let me come in quickly. I know that South Africa has been a very good example. They have used the private healthcare institutions to be service delivery points, and they have really successfully used them. Yeah,
Dr. Bzai, in addition to that?
Yes, I would also add, yes, depending on which part of the delivery they're talking about, yes. I was specifically talking about vaccine delivery in terms of the logistics bit. And I know that in Mozambique, as well in other countries as well, private sector outsourced companies have been used in that sense.
Thank you so much. 1 hour seems to run so fast. So I think before we close, I would want to give a minute or so to the panelists to say something as closing remarks. So let me ask Dr. Shibeshi to give your final remarks.
Emmanuel, thanks. Briefly, what I would say is that Africa has demonstrated to do large vaccination campaigns. Take every country against meningitis, against yellow fever, including adult population. Several measles campaigns, we've done it. The only thing is the supply and the coordination challenge that we had, which affected the planning and distribution, plus the health system that is tested not only in Africa, in the whole world. Really, it brought out all the issues of the health system. COVID has brought that. However, I think as a generation in the health workforce, all of us have to be accountable in making sure what best push could we give to the countries to support them so that they reach their milestones. One is the supply, really consolidating what was promised by the developed world, by the Western world, all right? The second is keeping on, let's strengthen the system. COVID may go, but other diseases may come. So I think we should strengthen the system, keep on working on that. Thank you, Emmanuel.
Thank you so much. Over to you, Dr. Bzai.
Thank you, Emmanuel. I think in closing, I would say that what we need, we have the goal, we need a roadmap to get us there. And for me, that is one of the things that is really urgent at this point, is for each country to develop its own roadmap. But even as we do that and realize that this is a marathon and not a sprint, we also need to ensure that we're taking into account all of the lessons that we're learning as we go, and that we are sharing them and doing better. I think we're already seeing that as the different COVID waves have come and gone, our response has improved, and it's really critical that we continue to interact and leverage the lessons that we've learned. Finally, I would say we need to keep the equity hat on all the time. We're talking about 70% of the world, of a world that's very different from one place to the other. And so even as we talk about targets, as we talk about solutions, we always need to ensure that we're keeping our equity cap on to ensure that those who are most vulnerable will also be part of this 70% or plus. Thank you very much.
Thank you so much. And over to you, Dr. Tabrashi.
Thank you, Manuel. In its disruptiveness, what COVID has done, it has awakened a giant. And that is becoming evident daily because the realization of the inequality and the inability of low and middle income countries to be self-sufficient is profound. The one thing that I can say on the question, what opportunities has COVID-19 created? In the field of technological innovation, it was profound. mRNA or RNA platforms are 20, 30 years old, but in the last year, in a fast-track, innovative way, those platforms were applied for the first time to bring safe, effective vaccines to the market. That has created a blueprint which provides enormous impetus and momentum for us in low and middle income countries to replicate, to build, and to expand. I do believe that the very important success factor for us is going to sit in partnerships, public-private partnerships. So let's partner, keep the goal in mind, and work together. Thank you very much.
Thank you so much, Professor. Yeah, I'm afraid that's all the time that we have for today. Time runs so fast, but I want to take this opportunity to thank each of our phenomenal speakers for their insights on what it will take us to translate the commitments into action to vaccinate the planet 70% over the next 1 year. And for those of you who have been tuning in from around the world, we thank you so much for your participation and thoughtful questions. Definitely, unfortunately, we weren't able to get to all the questions because there were many but very good questions, but we've taken note of them. And we hope that we will continue to engage either through a webinar like this or different ways. And for sure, whether our path is new to you or you've been following our work over a long time, we appreciate talking to you. And we appreciate that you've given us your time today. Please do stay in touch. Do stay in touch, either tweeting or chats, and we will definitely deal with these issues next time. And we definitely hope to see you next time when you log on for any of our future events or forums around these topics of interest. So we thank you so much. Thanks to our speakers. Thanks to the audience. Thanks to everyone. Please keep safe and stay alert. Thank you and bye.
Thank you.